Alright guys, this is Dr. Manish Chhabra, your ophthalmology educator. Now this is the very first episode of the new series which I am starting, that is OTC, Ophthalmology Tuition Classes. And trust me, it has never ever been done before. So the idea is to take everything conceptually, and I am going to follow the chapters which are given in your standard textbooks. So we'll be approaching each and every topic in a very detailed and very conceptual way. And the idea is to start from scratch. Even not only an MBBS student, I believe even a 12th grader can sit in my class and can understand what I'm trying to make you understand. So with this series, I aim to empower all of you guys who are seeking to learn ophthalmology in a very conceptual and detailed manner. Yes, so the idea is, if you are a fresh entrant in your ophthalmology clinics, if you are a fresh entrant in a prof where you have a subject called ophthalmology, so you will be able to understand it pretty well and you will be able to connect the dots. So in view of that, so I thought to start. So I was thinking how to kind of come forward in front of you and how to devise it, how to present it so that it becomes a cakewalk for all of you. So after a lot of hustle in my head, and I have finally decided to start this ophthalmology tuition classes for you guys, and the classes are going to be of not long duration like 2 hours 3 hours, no. So I'll try to restrict the classes for just 30 to 45 minutes per session, so that when you come from your medical college, you sit, you go in the mess, have your dinner, you just relax and you quickly go through it. And 30-40 minutes per video will be enough to keep you connected to me as well as to ophthalmology, because I am representing ophthalmology here to all of you. All right, so I'll be using various techniques to make you understand. I'll be using my model of the eye, which of course is given to me by a medical representative. So I'm going to put this into good use, and I'm also going to take use of my real patient videos which I have collected over the years. And I remember it was year 2020 when I conceived an idea of presenting all my students with real patient videos, so that all of you have a feeling of sitting with me in my OPD. And I also show minor procedure videos, main OT videos, and minor OT videos and everything, right? So that wherever you are studying, so it doesn't become a barrier to you, right? So in some colleges there's a lot of patient rush, while in some colleges the patient rush is relatively low, while in some colleges you don't get so much of exposure. Because if we see, so in the entire MBBS journey, you get only 30 days of your clinical posting in ophthalmology. And yet, ophthalmology being a very important subject, remember, it's a common saying, जग से संसार जो है वो आंखों से ही है, अखियों तो ही जग है, अखियों तो ही संसार है. समझ पा रहे हैं? So just 30 days are devised, right? And छोटी सी आंख है, but there's a lot of things which is inside, and trust me, it is a very interesting subject, and it is my responsibility to make it even more interesting by using different tools of teaching, and I am sure that you are going to love it. Okay, so, and yes, and you can always follow me on my Telegram channel, and that is Ophthalmology by Dr. Manish Chhabra. Yes, and of course follow me on my YouTube channel by the same name, Ophthalmology by Dr. Manish Chhabra. You can also follow me on Instagram, that is I_Manish. I means I and I means I_Manish. So that you are constantly in touch with me. And also you can, if you have any query, if you want to ask something, maybe for your prof practicals, maybe if you are a postgraduate aspirant who is watching this video, want to ask how to prepare and want to know an answer to a controversial MCQ, maybe you can always WhatsApp me and I'll try to respond to you in as less time as possible. Yes, and let me tell you, I am one of those faculties who have a very less response time. Yes, so the moment you will send me a message, there are high chances that you are going to get the reply in a very less time. Okay, so now I am going to start the very first chapter, and in this first chapter we are going to discuss embryology and anatomy. Yes, and I am going to follow the sequence as per your standard textbook. So what I suggest all of you is, first go through this particular video, then read it from your textbook. Yes, and then it will become easy for you to understand it, to connect the dots. And even after this, if you have got any doubts, any queries, you can always get back to me, right? Okay, so embryology and anatomy, and second chapter will be physiology, and slowly and steadily we shall be proceeding forward. Okay, now let's start with the very first topic, which is your embryology of eye. And also please make notes. Yes, the idea of tuition classes is to not to give you everything printed or everything in a pre-written format. So try to make notes, maintain a register, maintain a good register, and you have to make notes, right? It will help you, right? And during the nth hour of your university exam, during the nth hour, especially if you are, see, ophthalmology is not only important for MBBS, third prof or final prof, third prof part 2 students. Now ophthalmology is in third prof part 2. Not only important for those, but it is also important for the students who are doing BSc Optometry. Okay, so if you are an Optometry student, still you have to make your good notes, right? And these classes will be helpful not only for the prof students, but also for Optometry students, but also for the ones who are postgraduate aspirants and they want to touch the subject in details. If you did not read ophthalmology well in your prof, so this is the chance of you for you to go through it and know everything in details. All right, okay, so now after having said this, after a short introduction of how we are going to proceed forward, let's start with the very first topic, which is your embryology. Now eyeball starts developing at 22nd day of gestation, so you can say third week of gestation, right? Okay, third week of gestation, end of third week of gestation, right? So here is an image where you can see this outermost layer which you see dotted is your surface. So I'll reframe from writing short forms because I know you are new to ophthalmology, so it is my responsibility to make it interesting but not to confuse you. Yes, so this outermost layer is your surface ectoderm, this middle is your mesoderm, and inner is your neuroectoderm. Okay, all right, neuroectoderm. Now you must have read in your anatomy that there are three parts of the brain. So there is forebrain. Write with me, don't just watch it, write with me. Forebrain, there is midbrain, and there is hindbrain. Yes. Now forebrain is prosencephalon, midbrain is mesencephalon, and hindbrain is rhombocephalon. Yes, rhombocephalon. Now prosencephalon is divided into further two parts. One is your diencephalon, and we have got telencephalon. Okay, telencephalon, please write with me, please, telencephalon. Now there is extension of this part of the prosencephalon. So there is extension, so you can see here, so it is getting extended on the lateral side. So this is your actually diencephalon. I have just written there. So there are two diencephalons which are coming outside from the lateral side, and later they will move anteriorly. Yes, so I am going to draw it here. So this is, let's suppose this is your forebrain, prosencephalon. Then there is extension of the part of forebrain which is particularly diencephalon. Yes, so this is known as, because it is going to form eye is something related to optics, so you call it as optic stalk. Now the distal end of the optic stalk is going to transform into a bulge. You call it as optic vesicle. Okay, now this bulge is going to form a cup like structure, so that I'm making it here. So this is your optic cup. Okay, so there was optic stalk, the distal end of which formed optic vesicle, and which get transformed into optic cup. So if you could see here, so this is going to form optic cup, and which is this layer which is lying just anterior to the optic cup, boys and girls. So my dear friends, this layer is, you already know, this is your surface ectoderm. Yes, so I am going to make it here. So this is your surface ectoderm. So this is your optic cup, and this layer which is anterior is your surface ectoderm. Okay, now this optic cup is going to form retina. Yes, and this surface ectoderm is going to invaginate into a single cellular round structure which is going to form your lens. Let me just draw it for you. So this is your optic cup again. Now the cells of the surface ectoderm which just lie anterior to the optic cup, they will get transformed and they will be called as lens placode. Okay, now these lens placode, they will turn inside so that they will get detached from the surface ectoderm, and they are going to come to lie in between the optic cup, just like that. Check this out, how beautiful it is. So they are going to invaginate like this. They are going to see, you have to draw with me. Yes, okay, I know you are very good hard-working people and you will do it. Yes, so there is invagination, so nucleus, and eventually now the same optic cup, and there is a single cell, beautiful structure, and again there is a nucleus. Yes, okay, and this is again your surface ectoderm. Okay, So this is known as, so lens placode. Now this is a rounded structure, lens vesicle. Now this is going to form your lens. It is ultimately going to form lens. Okay, all right. So this is very basics. As we will proceed forward, I'll let you know how it is formed, so what things which are happening. So right now you have understood that this is going to form a retina. This optic stalk is going to form your optic nerve. Optic nerve, this is your retina, and this is going to form your lens. We shall proceed forward. Okay, now so this is how some structures of the eye is formed. Now can you see this white stalk? This is nothing but your optic nerve. Can you appreciate that there are 3 layers of this eye? So outermost is white, then you can see that there is pink, which is choroid, then innermost is your yellow, which is retina. So let's talk about the coats of the eyeball. Let's talk about the coats of eyeball. So it has got 3 coats. One is outermost coat, which is known as tunica fibrosa. It is fibrous, है ना, fibrosa. So it is your sclera. Write with me. Second is your inner coat, because choroid receives maximum circulation of the blood. So you can also call it as tunica vesculosa. And this is your choroid. Okay, now third is the innermost coat, which is your tunica interna. Which is your retina. So there are 3 coats of the eyeball. Now let's identify these 3. I hope you have written it. Yes, take the note very carefully. So once we know that there are 3 coats of the eyeball, so let's identify the 3 coats here. Okay, so now check this out. So this outermost coat, you can see that it is your sclera. Can you appreciate? I am highlighting it. Then the middle coat is your choroid. Just near to sclera I have highlighted choroid. Then there is innermost coat, which is your retina. Now retina has got 10 layers. Retina has got how many layers? You have to repeat after me. 10 layers. Inner 9 layers are neurosensory layer. So innermost 9 layers, here it is written, it is also known as photosensitive retina. So it is neurosensory retina. The other name is neurosensory retina. While outer 10th layer, so inner 9 means from inside, inner 9 layers, outer 10th layer is your pigmented epithelium. So this is your outer 10th layer, which is pigmented epithelium. Okay, all right. Okay, now I am going to show you one beautiful demonstration of your anatomy of eye. Now check this out. So there is sclera. So I told you that outermost coat is sclera, but so there is a central glass like structure which you see. So outermost coat is sclera, which is actually surrounding the eyeball, posterior 5/6, while anterior 1/6 is by cornea, which is a transparent structure. Right? Check this out. Can you appreciate? So I am just going to, now can you appreciate the whitish part? That is your sclera, the outermost coat. What is the name of that coat? Tunica fibrosa. Okay, now you can appreciate the middle coat. You can see a lot of blood vessels in the middle coat. That is why we told that the central part, the central layer is choroid, and it is most vascular part. Okay, all right. So this is your choroid. Okay. Now the innermost part is your retina. Okay, so you can appreciate that outermost green part is your sclera, the middle red part in this video is your choroid, and the inner yellow part is your retina. Okay, all right. Now but the anterior part, anterior 1/6, anterior 1/6, boys and girls, and it is your cornea. All right. Okay, now after having seen this, let me make you see something else. So I told you that the central part of the eye is the most vascular part, है ना, choroid. Now let's talk about the blood supply of choroid first, then we shall proceed to the inner structures of the eye. So just check this out. So what happens is, you know there is internal carotid artery which gives a branch which is known as ophthalmic artery. Now this ophthalmic artery enters the orbit through the optic canal. Through the optic canal, let me show you first the anatomy of orbit, then you will be able to appreciate it in a most beautiful way. Now check this. So you can check this out. So this, yes, can you check that the blue bone in this video is your frontal bone? Yes. Can you also see that the central orange bone is a butterfly shaped bone, and that is your sphenoid? So sphenoid has got three parts. One is the body, which is central, then the lesser wing of sphenoid and greater wing of sphenoid. Now can you see that there are two fissures which is on the right side and left side, that is known as superior orbital fissure, which is a J-shaped fissure. Yes, can you also see that just above the body on the two parts, on the temporal, superior temporal part of the body, you can see two holes. This is your optic canal. Yes, now can you see the two holes? Yes, I think now you can see the two holes near clinoid process. This is your optic canal, from where there is optic nerve and ophthalmic artery that enters inside the orbit. I hope it is well understood. Okay, now having understood this, let's get back to our old video which I was showing you before. Now check this out. So there is the ophthalmic artery, there is optic nerve which is yellow and which is continuing inside the orbit, and it goes in the orbit via optic canal. So after entering into the orbit along with ophthalmic artery, which is a branch of your carotid, internal carotid artery, just 1 centimeter before entering into the eye, the optic nerve, the ophthalmic artery gives a branch which is your central retinal artery. Central retinal artery actually enters just 1 centimeter before. Normal is 8 to 15 millimeter. On an average, we take it as 1 centimeter, means 10 millimeter. So before 10 millimeter, it enters into the optic nerve, and then it comes to the retina and supplies the retina. Okay, check this out. So you can see that there is optic nerve. Okay, now in this view, check this out. There is ophthalmic artery which is continuing along with optic nerve, and at just 1 centimeter before, it is entering into the optic nerve. Now there are more branches of the ophthalmic artery inside the orbit. Now please see here, please focus here, I'll make you write, don't worry. And there are first short posterior ciliary vessels. So short posterior ciliary vessels are 10 to 20 vessels which arise from ophthalmic artery. They pierce the sclera and comes to lie inside the choroid. Okay, then we have got, wait, let me just show you short. Yeah, Wait, now can you appreciate short posterior ciliary arteries, which are branches of ophthalmic artery? They are piercing the sclera and going into the choroid, so they form the choriocapillaries inside the choroid. Okay, and please remember, choroid receives 85% of the blood supply which eye receives. Eye means aankh. Okay, so 10 to 20 vessels, short posterior ciliary arteries. Now coming over to the next set of vessels, which are long posterior ciliary artery, one on the temporal side, another on the nasal side. So these are two in number, as you can see in the video, and they are going up to the root of the iris. One is temporal, another is nasal. Is it understandable? So short posterior ciliary vessels, long posterior ciliary vessels, then there are anterior ciliary vessels. What are anterior ciliary vessels? So there are muscles which help in movement of the eye. You must have read in your first prof. Yes, so there are muscles which help in the movement of the eye. Those are extraocular muscles. So there are 6 extraocular muscles. One is inferior rectus, inferior oblique, 2 muscles. Then there is lateral rectus, there is medial rectus, there is superior rectus, superior oblique, 6 muscles. Now these anterior ciliary arteries, they are 7 in number. They arise 2 from the superior rectus, 2 from the inferior rectus, 2 from the medial rectus, and 1 from the lateral rectus. So in total they are 7 in number. So let's revise. So one was your short posterior ciliary arteries, which were piercing the sclera and going to enter into choroid. Another was your long posterior ciliary artery, one on the nasal side, one on the temporal side. They are going to the root of the iris. And third is your 7 anterior ciliary arteries, 2 from superior rectus, 2 from inferior, 2 from medial, and 1 from lateral rectus. Okay, all right. So this is your blood supply of uvea. Now coming over to the venous drainage. If we talk about venous drainage, so there are 2 veins which ultimately take the blood to the cavernous sinus. So one is superior ophthalmic vein, another is inferior ophthalmic vein. 2 veins. Now superior ophthalmic vein, inferior ophthalmic vein, they drain the blood from the eye, indeed, no doubts about it. Yes, but there are 4 more veins, that is your vorticose veins. What are vorticose veins? You can see superior and inferior ophthalmic vein. Now there are vorticose veins which are 4 in number. They are believed to be present in each quadrant. If you divide the eye, right eye, 4 quadrants: superiotemporal quadrant, superionasal quadrant, inferiotemporal, inferionasal. Yes, so there are 4 quadrants, but they are arising just behind the extraocular muscle insertion. 4 veins. So the 2 veins, superior, are draining into superior ophthalmic vein. Inferior vorticose veins are draining into inferior ophthalmic vein. Is it understandable? समझ में आया? Okay. So this is the arrowhead is showing inferior vorticose veins, and ultimately they are going where? They are going into cavernous sinus. I hope it is clear. So लिख लें एक बार. लिखना है सब कुछ, मिस कुछ नहीं करना है ना? एंड आई गिव यू, नो वरीज, आई गिव यू एनोटेटेड नोट्स, बट हम लिखेंगे अपने नोट्स हैं. अभी तो हमने आई पढ़ना स्टार्ट करे है ना, तो इसलिए प्लीज राइट विद मी, विच इज योर ब्लड सप्लाई ऑफ यूविया. ब्लड सप्लाई ऑफ यूविया. सो फर्स्ट इज वी हैव रेड 10 to 20 SPCA, फुल फॉर्म लिखेंगे, मिस कुछ नहीं करेंगे, विच इज योर शॉर्ट posterior ciliary artery. Short posterior ciliary artery, 10 to 20 number. Then 2 we have got long posterior ciliary artery. सब कुछ सेम रहेगा, बस long PCA कर दो. They are 2 in number. ठीक है जी. और ये जो short posterior ciliary artery है, it is 10 to 20 number and it pierces the sclera. It pierces the sclera, while this is unbranched. This is your unbranched, and one is your nasal branch, मतलब nasal side, another is on the temporal side, and both of these end at the root of iris. कहां तक जाएंगी जी? बोलेंगे मेरे साथ, root of iris. Okay, then third is your anterior ciliary artery. Anterior ciliary artery. So they are how many in number? They are 7 in number. 7 in number, and 2 arises from a superior rectus muscle, 2 arise from inferior rectus, 2 arise from medial rectus, 1 arise from lateral rectus. Okay, lateral rectus. But just make a small cute young little box, है ना? You guys are also very small, cute, young little kids, है ना? So there are 6 extraocular muscles. 6 extraocular muscles. One is your superior rectus. Another is your inferior rectus, then medial rectus, then lateral rectus. So basically 4 are your rectus muscles and 2 are your oblique muscles. 2 are your oblique muscles. So which is your superior oblique and inferior oblique. Okay, just for reference, we'll be doing everything in detail, don't worry at all. Okay, so this is about the blood supply of uvea. Now coming over to, just make another box. So there is which artery? There was, whichever we saw in the video, there was internal carotid artery, which was given a branch to ophthalmic artery. Yes, ophthalmic artery. And ophthalmic artery was forming central retinal artery. Also ophthalmic artery was given a branch to short posterior ciliary artery. These are branches of ophthalmic artery only, long posterior ciliary artery. While anterior ciliary arteries, they are arising from the muscles. Okay, so I hope you are able to now connect the dots. So short posterior and long posterior ciliary artery, they are the blood supply of uvea. But central retinal artery is going towards the retina, and just once, or as I told you, 8 to 14 millimeter before entry of optic nerve in eye, CRA, which is central retinal artery, enters in ON. ON means optic nerve, and supplies retina, as we saw in the video. Okay, now if we talk about venous drainage, so there is your superior ophthalmic vein, one. Second, there is inferior ophthalmic vein, 2. And ultimately these veins are draining in cavernous sinus. Clear? Now along with it, there are 4 vorticose veins. One in each quadrant, means each quadrant. One in each quadrant. And superior quadrant, so superior ophthalmic veins receives superior quadrant, while inferior ophthalmic vein receives inferior quadrant. Now this is about blood supply, means artery and vein circulation of the eye. Okay, so guys, एक बार दोबारा से रिवाइज कर लें. So I think this is enough for today. I think we are almost 30-35 minutes हमारे हो चुके हैं. तो I just want to keep these lectures very small, not very large, so that quickly you are able to see it. Okay, so आज के lecture में हमने क्या पढ़ा? First I told you about the coats of the eye, outer coat, middle coat and inner coat, and we also read about anterior 1/6 cornea. We also read about the development of eye, which starts at 22nd day of gestation, and also there is forebrain, midbrain, hindbrain. Forebrain is your prosencephalon, from which there is an extension which is diencephalon, which forms the optic stalk. That extension and distal end of the optic stalk is optic vesicle, which transforms into optic cup that forms retina. So if I may ask you, retina is derived from, of course, neuroectoderm. Why? Because it is derived from optic stalk, which is forming optic nerve, which is further extension of prosencephalon, which is neuroectodermal in origin. भाई अगर आप आम का पेड़ लगाओगे तो उसमें अमरूद थोड़ी ना होंगे, है ना? So because there is extension of the prosencephalon, which is neuroectodermal in origin, so all the structures which is formed by the optic stalk will be neuroectodermal in origin, including your optic nerve, including your retina. Okay, and it starts 22nd day of gestation. And you also read that there is anterior layer, which is your surface ectoderm, okay, which invaginates to form a single cellular structure. You call it as lens vesicle, and lens vesicle is derived from surface ectoderm. So lens is also derived from surface ectoderm. Done? Okay, so this is all what we read in today's class. So next class we are going to continue with where we have left. So the bell has rung, so the lecture is over for now, and I hope, please give me your feedback. I'll be seeking your feedbacks, how you liked the very first lecture. And yes, thank you very much for spending some minutes of your life with me, and I'll try to make you feel very confident in ophthalmology in due course. That is my promise to you guys. Thank you very much.